So, first of all, it's not completely free. You're all paying for it. Just to be clear, you pay for it. It's not free. And it's not free. So that's the first thing. The second thing, you know, the NHS is in a crisis right now, right? But the idea isn't. And you need to think about what happens in countries where they don't have the NHS, right? And you talk to people, as I have done, who can remember health and social care before the NHS. It wasn't good. And right now, I was in hospital the other day. If I went to the nurses who were looking after people in corridors and said, you know what we need now is reform, right? It'd be about as popular as a cup of cold sick. So this is what we need to do. This is what we need to do. The first thing we need to do is to acknowledge that we are in a crisis right now. People are on strike. Government needs to get around the table. You need to sort it out. You need to sit around the table and talk about pay. Firstly. And you know, we've been saying this for a long time. Members have been saying this for a long time. We need a proper workforce plan, by which we need a long-term plan. So we know how many nurses we need now, how many nurses we're going to need in the future, what we're going to need to do, what they're going to need to be paid. And thirdly, we need to stick with the reforms that we've just had. Remember, in July, right, we passed, and there was general cross-party support for this, a bill that created integrated care systems, population health. They've just got started. We need to start creating healthy communities. So we need hospitals less, and my members would love that. And we need to start spending. So when you say we're spending more than ever, I was saying, of course we are. We're absolutely great. We're not spending enough. That's the problem. We're not spending enough to meet the demand. And it varies. The thing that, I'll just say this and I'll shut up. The thing that really worries me, what really worries me, if you're in the poorest parts of London, your active life expectancy, right, is around 55. In the richest parts, it's 60. Now, that is not well over 60. That is not only immoral, it's expensive. And that's why we have the NHS, right? And that's why you pay for it. It's not free. It's not free.